Thank you for coming today to attend our session on hunger in Marathon County. I'd like to introduce Joanne Janikowski, who is the Community Impact Director at the United Way. She's here on behalf of the Marathon County Hunger Coalition, and she can explain what they do much better than I can, so I will defer to her. And we are partnering, the library is partnering with the Marathon County Hunger Coalition on a food drive this summer, so we will be collecting goods at all of the Marathon County Public Library branches throughout the summer, and the United Way will distribute them to area food pantries. So without further ado, Joanne, thank you for coming.
Thank you very much, and thank you everyone for coming out on this very beautiful day, the sunshine outside. I thank you for coming in and coming in to listen to the presentation. First of all, I want to say that I am not an expert on hunger, and I share that with you because the true experts on hunger are the people that are at the table for the Hunger Coalition and doing face-to-face work every day. And there are a lot of people that are doing the face-to-face work that are not at the Hunger Coalition table. So I'm not going to stand in front of you today and tell you that I know everything on hunger. Instead, I'm going to stand in front of you and share with you that I want to be a conduit of information. I want to share with you what different groups have shared with me. And then I want to encourage you to be part of the community conversation that we'll have before you leave today to help me identify, you're the eyes and ears of this community. Help me identify what's being done well, what could be done better, and I want you to brainstorm ideas because the greatest ideas come from people in the community who have passion about this topic. So this is going to be a fairly interactive presentation. So I'm not going to break you into groups, but what I did give to you is I gave you some cards to share information. So I'm hoping that you'll be willing to turn those into me at the end, so I can use those at the next Hunger Coalition meeting and share the information with the group. So first of all,
What before?
oh, there we go. I would like you to picture hunger. And when you think of hunger, what picture comes into your mind? And you could take and you could write it on this little sheet of paper if you would like to. But I'm going to go around and ask around the room, what comes to your mind when you think of hunger? So I'm going to give you a couple of minutes. Oops. And everybody should have a pen also. If you don't have a pen, let me know. Bless you. Thank you. Bless you. There's something in that row.
We're learning one another.
Welcome. So I'm going to start over on this side. Have you had enough time to think about it? Okay.
Well, I don't think I'm qualified to talk about hunger. Our church does a Presbyterian dinners 4 times a year. And I've been a part of that early on when I was first coming. So I see the face of hunger there. And a lot of times it is mentally ill folks that aren't able to work.
Okay. Are you with First Presbyterian now?
No, I'm with Emmanuel.
Emmanuel. Okay. All right. Would you like to start?
Physical hunger I picture as a gnawing in your stomach for food, but there can be other hunger as well, companionship.
Yes.
So that's what I would picture hunger as.
Okay.
When I think of hunger, I think of anxiousness.
And what do you mean by anxiousness?
Just anxiousness
Okay.
Well, I feel hungry at 5 in the morning, my tummy hurts. So this morning I got up and had a piece of toast and went back to bed.
Okay.
But, yeah, I can't imagine. Like I was telling my two little, when they were little, they used to always tell the people, "Ma never gets us supper." Can you imagine the poor little kids going to bed hungry? Well, they never did. They thought they did.
Okay.
I imagine a family that, you know, the child says, "I'm hungry," and they have nothing to give them.
Okay.
I have nothing to add.
Okay.
We used to work at the middle school, and we had kids that came to school. I had dinner the night before, or breakfast the morning of, and we expected them to learn.
Okay.
Like I've been on vacations and I've seen people either like laying and sleeping on the streets with like shopping carts and coats, and some people like collecting garbage and cans.
I think the one thing is, could be anyone, you know, I think everybody is just one catastrophe away from being in the same shoes and just opening up to.
Okay.
Well, I came in here late, but when I think of hunger, I think of children and hunger, and I heard recently that now that children are out of school, it becomes such an issue because they don't have those meals in school. And in Milwaukee, it's an amazing percentage of children who are what they call, I forgot what, there's a term for it, but they're just so afraid every day because they don't have anything.
Okay.
Interesting articles that she must have been reading about the kids, that face the hunger of children, especially out of schools when they have no capability to get breakfast or lunch, you know, and then they have nothing.
All right. Well, thank you all for sharing, and all of you are right. The hunger looks different for different people, based on the situations we've been in, what we've seen, what we've heard, what we've read. This is how Merriam-Webster defines hunger. And this gets at what some of you were talking about, that uneasy sensation, that feeling of not having enough, that urgent craving, that weakened condition. I put all of these pictures up on here because when we think of hunger and we think of the things that we have seen, I have heard in our community that people aren't hungry, they're not starving. Maybe not. Maybe they don't look like this, but that doesn't mean people aren't hungry. Disaster, we have situations where there's disaster and people are hungry short term. But then we have what we see and what the people at the Hunger Coalition table see and other groups working on hunger see. And I think if I split this line and I go in this direction, this fits more with what we see in our community. So we don't really have a measurement for hunger. The USDA doesn't have a measurement for hunger. FRAC doesn't have a measurement for hunger, which is the Food Research Center. We measure people's levels of their experience with being able to get food or not get food. So the USDA measures food security or food insecurity. And I provided for all of you the definitions because they are long definitions. So in your handouts that you have, there are definitions for all of these. But in short, if you measure at high, you have consistent access to food. And at the very lowest level, you actually have reduced intake of food. meaning that you don't have the resources, that someone goes to bed hungry at night, meaning that somebody on the weekend does not have food to eat, or that during the summer, when other programs are not available, some of the children out there don't have food. So food security in the United States. In 2013, 87.7% of people were considered food secure. So they fit up in that high level. 14.3% were food insecure. 5.6% were very low food secure, meaning 3.8 million households. And out of all of those households, out of the 14.3%, 62% were food insecure, or 62% of the food insecure households tapped into these 3 programs, which is fantastic because that's what the programs are there for. We want people, if they qualify for these programs, to sign up and get the assistance from these programs. They are supplemental assistance programs, very helpful across the United States, underutilized, and in this community, underutilized. So food security in Wisconsin. In the period of 2010 through 2012, 11.2% of households were food insecure. So if we compare us to the United States, at the same period of time, it was 14.5%. So we are better than the United States as a whole. We are better than some states that were around 20.9%, that's Mississippi. But we still have a significant percent of people in our state that are struggling with food insecurity. The other measure, and I mentioned FRAC before, the Food Research and Action Center, the other measure is food hardship. And this is a question that is asked on a survey. So their food hardship is determined by the number of people who say yes to this question. Did everyone have a chance to read that? So food hardship in the United States. In 2014, 17.2% of people in the United States reported food hardship, which I think is unbelievable for the United States. That means 1 in 6 households are reporting that they're struggling. As far as Wisconsin and food hardship, in 2014, 12.4% reported food hardship, and as a state we ranked 46th out of 51, which means as a state we look pretty good compared to some of the other states. In District 7, which Marathon County falls in, we are in the blue right here, 13.5% reported food hardship. So Marathon County is a little bit better than the entire district because the poverty levels are higher in some of these northern areas. So as far as food security and hardship factors across the United States, across the state of Wisconsin, the top 5 factors that were identified were employment, wages and benefits, education, health, supports, and access. And I'll get into a little more details about each of these when we talk specifically about Marathon County. So Marathon County, just a little background on us. We are 1,576 square miles. That's not all land mass. Some of that is water. But we are larger than the state of Rhode Island as a county. We are a mix of parks and rivers and lakes. We are a beautiful blend of people. The top, or the 95 or 98% of the total population, 91% is white, 5% is Asian, and 2% Hispanic. And the remainder of the population falls into, I believe, six other different categories. The median age in Marathon County is 39. What I would like all of you to do, I'm going to go backwards here just a little bit. So as I mentioned, across the United States, these are the top 5 factors identified for food security or hardship. What I would like you to do is I would like you to take the little sheets of paper I have provided for you, and I would like you to write what you believe the reasons are for people struggling right now with basic needs or food hardship. And some of you mentioned some things earlier, but I would like you to identify for me what you're seeing in the community. So another way of stating factors would be people are struggling because they don't have jobs. People are struggling because they don't have education. People are struggling because of health issues. Supports, meaning family supports, childcare supports, and access, meaning things like transportation or other resources to be able to access here. Who would like to share with me what they have on their list?
Sure.
Okay.
I think health issues is a big one, but more so than that is supports, and I don't think it's a lack of support. I think it's a lack of the knowledge of what support is out there. You know, as you said, there's programs that are not being utilized because I think people don't know that they're available.
Okay, excellent point. Would you like to share?
Oh, I just went back, no. I'll say anything.
Sure, just one
I think
back.
a lot of it is a family environment, that they've grown up in a family that has not a high work ethic and have not had the values that a normal family passes on to their children. So it's kind of like getting a rut.
Okay. And we hear about challenges with generational poverty. So is that kind of a little bit of what you're alluding to? Okay. Who else would like to share? Thank you.
I don't need a bag.
Okay.
I think there's some underemployment too. Like they have a job but it doesn't cover everything, and then that overlaps, and they all intertwine. If they don't have enough money, they can't get the health care that they need. If they don't have enough money, they can't get transportation, so they don't have access. So I think they sometimes all intertwine with each other. There's not just one issue. I think it's all sometimes several.
It's very complex.
Yeah, it is complex.
Yes. Thank you.
I'm going to build
Okay.
off of what Sue said, but
All right.
I think it's that working poor that, they've got so much debt from, I've met so many college graduates that cannot get a job because the jobs are so specific. So they're going back to school and working part-time or 2 part-time jobs. So trying to provide for their family and the school, but it's just not cutting the mustard. And it's that vicious cycle that's going around and around and around. So if they don't get a job in one area, then they feel they have to go and try to find some other training. But people with bachelor's degrees and, having lunch at Salvation Army and just meeting these people that they have just as much education as I do. It's just finding the right ways to put it in.
Yes. Excellent point. Did you want to pick?
No, I'm good.
Okay.
Thanks.
Would you like to share some of your ideas? Yep.
I don't have a lot of experience with hunger in the community, and I don't see it a lot, although it's something that concerns me a great deal. So I can only tell you what I have read.
Okay.
I don't work in the area, in hunger, but I have read that addiction is an issue. So I think when we talk about feeding, people kind of have to look at some of those underlying issues and address those, because you can provide food, but if some of those bigger problems aren't solved, it's not something that lasts.
Very good. Thank you for sharing.
Oh, yes, and I really would like a book.
Okay.
Well, Lauren, you really started something.
Would anybody else like to share? Anybody else interested in
Well, I
sharing?
was thinking about, my son's got a job, but he works for peanuts, not even enough to pay for gas. So, it's hard.
And that was the point that you were making about underemployment.
Yeah,
That was my first job. I had to have 2 jobs.
There's jobs out there, but they don't pay.
The working poor.
Yes, yes,
You got 20 miles to go and come.
yes. And that makes it very challenging, especially when you're trying to cover the cost of
Yeah.
gas for
Trying to
transportation.
help.
Yes.
Yeah.
Okay.
On the other hand, if they pay a higher wage, then the kids in high school, they won't be able to find a job either.
Yeah.
Because there won't be the businesses won't be able to pay everyone the same wage. So then how do they decipher a person that's under the age of 18?
And we have heard some of those same things from businesses in our community.
Right.
I'm going to share with you on the slide that will come up here what we're hearing from providers, meaning people who are in the field working with people who are struggling, in comparison to what we're hearing from the business community.
Just want to make sure it looks different. Okay. Is this where you want it?
Yes,
Okay.
thank you.
Oops, sorry about that.
Okay, do you move fast forward here? It's funny how we get so used to our technology, and then when you have somebody else's, it's... Okay. So this slide shows from United Way's strategic planning process, from community conversations, and from survey results, what we heard from the service and recipient sector and what we're hearing from the business and education sector. So what we're hearing from the service sector, which would mean some of you here in this room, and places like the food pantries and the churches, is that unemployment or underemployment is a huge issue, meaning that wages, even at 40 hours a week, aren't enough to cover basic needs. We had a young woman who came into our office who was working 40 hours plus, but she was making minimum wage. And when you add childcare costs onto that, even with supports, she still is struggling to make it. Health and illness. Somebody had mentioned AODA issues. We are seeing a percentage of the populations that are coming in for assistance with AODA issues. Also a percent with mental illness. There are also physical illnesses that we're seeing people are struggling with. You had mentioned we never know. Early on, before I came into United Way, I did some in-home services for a program called CAST, where I went in and I worked with W-2 families. And when I was in training for that program, one of the presenters said, "We are all one bad slip on the ice away from needing services." And I think at that day it didn't really set in, but when I started to go into people's homes and realized what they were dealing with, Some of it, a lot of it was something they had absolutely no control over. It just happened.
I have a friend who works with homeless in Los Angeles, and I was shocked to hear her say that the average age for homeless women in Los Angeles, or maybe across, anyway, at least in Los Angeles, is 51. Now that, that has to be people who have had careers,
Yes,
who have had lives, homes.
people with degrees.
With degrees.
Mhm.
51 that's pretty old to start.
And I will speak for myself. Oftentimes, I forget the part that luck has in us ending up where we are in our lives. And that's not to take away from people who work really hard to get to the position that they're in. But luck also plays a huge part. Our DNA plays a huge part. I don't know if anybody in this room had control over their DNA, but I got what I got at birth. So there are health issues, chronic health issues in my family that I will have to deal with moving forward, that I have to be very careful about moving forward. But those are things I have absolutely no control over. Accidents, I've seen people who have gotten in car accidents, absolutely no control over, and they've ended up in a situation with long-term health issues. Lack of education or lack of access to education opportunities, basic, post-secondary, and financial. What we hear out there is that there are educational opportunities, but they're not always offered at a time when someone can attend. They're not always accessible because of the cost. They're not always accessible. I think of a single mom who has a little one at home. Can she get the supports that she needs to be able to go to school? Can she get the childcare that she needs to be able to work and to go to school? Now, there are some supports out there, but can she create that perfect package to make that work? That's where the challenge comes in. Assistance barriers and system deficits. Somebody was just sharing with me earlier about the school lunch programs and signing up for some programs. I haven't seen the forms lately for signing up for some of those programs, but I have heard that some of those forms are exceptionally complicated.
We all get them. I mean, whether you need them or not, you get them. I couldn't fill them out. Well, I should say I could fill them out, but I needed to. I can see somebody needing, and I have 2 degrees. I can see somebody looking at that and having no clue where to begin.
So how, that's a question of how do we change those systems to make those programs accessible and easier for people to tap into. The dollars are there. If they're underutilized, what changes do we need to make to ensure that people can get those programs and get the help they need? The other one we hear a lot in our community from the Hunger Coalition and the Housing and Homelessness Coalition is transportation is an issue in this community. Not all people have access to a vehicle. I don't know how many of you drove here today, but that's another thing a lot of people take for granted. I get in my car in the morning and I drive where I need to go. One of the volunteers has asked us to put out a challenge to people in this community to spend a week taking the bus system here and to try to get to work and to try to get to all of the places they need to go. And then, once again, I go back to that single mom. How does a single mom with little ones get her kids to daycare using the bus, get to her job using the bus, get back to daycare in time where she's not going to be penalized for being late, get to the grocery store? Those are major challenges for people. So we are hearing that a lot in our office. The business and education sector. What we are hearing from them is the health issues, AODA and other. We are hearing about education, which is what you alluded to too, about the match gap. People have degrees, but it doesn't always match the positions that are available in our community. So how do we get people trained up or educated to the point that they can fill those open positions? We're also hearing from some employers that they are getting employees coming in with very low-level skills, lower than they've seen in the past. We're also hearing from some of our nonprofits that people coming in for services, where they used to be able to start at a certain level with the people coming in, they are now seeing gaps in very basic skills that they haven't seen in the past. So the services and the amount of time it takes to provide those services and get somebody to a point where they are self-sufficient might be longer than it's been in the past. Lack of soft skills. Somebody had mentioned this. Lack of motivation and work ethic. We are hearing that from some employers. We're hearing a lot about reliability, dedication, and productivity. And then once again, we're hearing about the limited supports. So I think everything that everybody mentioned is actually up here somewhere. So Marathon County, relating back to that previous slide, what are the challenges that we're seeing? So from 2008 to 2012, our poverty rate, which we know is a complex issue, was 10.4% over a 5-year span. In the 2012 to 2013 school year, on average in Marathon County, 40 to 44% of students qualified for free and reduced lunch. And we know that in some schools in our community, there are as high as 70 to 80% of the kids that qualify for free and reduced lunch. This was also mentioned by the group, workers earning poverty wages. 28.4% of workers earn poverty wages or lower wages than are needed to keep a family of 4 with one full-time worker above the poverty line. 28.4%. And we know that 66.9% of adults over 25 in our community are without an associate or a bachelor's degree. Now, in looking at these numbers, I think they're great numbers, but there's a lot to question. What does this mean? What does this mean that we have that many people? It could mean there are people age 51 and over who were in positions and at one time didn't need this to make a higher wage. But things have changed. This has to do with the number of elderly living in our community. I know that there are people that are close to me that worked in high-paying positions and are now retired and in their 80s and did not have these degrees, and they didn't need it to make a livable wage. But times have changed. Any questions on any of these or any comments? I know there's some experts in the audience here who might be able to.
It might be a more pertinent number to know how many adults of working age don't have associated
Great
bachelor's
question.
degrees. Because elderly poverty seems to me to be a little different situation.
And I'm writing this down because I am always looking for ways to improve when I present. So if questions come up or you think dig deeper into that, that would be helpful for the community to know, I will do that.
I have a question. What about someone that's like a plumber or an electrician? Do they count as an associate's degree, or do they need a bachelor's? Because I mean, that's a very skilled profession. I
think I may use the wrong terminology. I believe there's different levels. There's a journeyman for plumbing, but there is also certificate level plumbing. Is it a journeyman? Is that the right?
Does that fall into your associates?
It could. If they do not have up to an associate degree, it would fall into this number. Yes. So if they need a certificate, I'm wondering about, like, now that you mentioned that, like welders and different groups. I don't know
Or
if the
tech.
degree they
I mean,
earn is
some of
that
the-
associate?
Some of the tech degrees aren't associate degrees, they're specific to a trade.
So they would fall into that. They would fit in this associate because this is not just the university system. This would be NTC also. But I think there are some trades that you can earn a certificate. But that's a good question.
I just don't know, I'm sorry, I didn't mean to.
No, these are great questions.
Or a beauty degree.
And I'll look, and I'm not sure.
Like, I'm thinking,
Yeah, I'm not
Yeah,
sure if
like a
that's being
beautician.
gathered, if that
Beautician or-
information is being gathered, but it would be great information to have, because that would shed light on this. But
Yeah.
what we know,
Seems very high.
we know that
Yeah.
long-term earning potential, people with an associate or a bachelor degree or above have greater long-term earning potential.
right.
But I don't know that about certificates. I don't, that's a great question, and I will
because
definitely.
those cost money to obtain. I mean, I'm thinking now beauty is in
Yeah,
my
like a
head, but like a
beautician,
beautician degree or a plumber or a HVAC or electrician. Those are all things that cost them money to go and get that schooling.
Right.
And once they do, they can work their way up. That
Right.
hasn't changed.
But I wonder if they're included
I'll
in
use
it.
that as an
Yeah.
example when I make the call to find the information, because like beauty degrees, welders,
Welders,
plumbers,
good one.
some of those things, those are really,
It's
those
just
are
such a
great
high,
questions.
that's such a high number, that's like 2/3.
On your previous screen, I've noticed in the last 40 years of my working history that there's been a dramatic change in the entry-level position. I was a nurse, so it was like entry-level positions of the work ethic and also the corporate. So there is a real social problem with not getting people that will station the job, do the job, come to work every day, and that used to be paramount. Well, rather, and now it's very poor. But in response to that, I think there should be some way to balance that, because businesses, I'm just talking generally, get stricter and it's just not working. They can't keep those entry-level positions, even working. Yeah.
So at the end of this, I'm going to ask you for brainstorms, and do you have an idea? What could we do differently as businesses in the community to keep those younger workers? I hear they want to work. I mean, it's not a matter of not wanting to work. But do you believe that there's always existed a percent of the population that falls
Yeah, I
into
do,
that
but I
category?
think the percentage is much higher now than it used to be 25, 30 years ago.
Well, and unfortunately, the policies are made for the people that don't come to work. The policies are made not for the people that are doing their job every day.
And the cost of hiring and then someone not staying.
Yes, turnover is extremely
Is
expensive, yes.
Exorbitant. Probably take care of all our food. I mean, change this. It's a very tough social problem.
So back to food security and hardship. There are essential strategies that different groups across the United States and in Wisconsin have studied. And this information is from FRAC, and this is actually what the Hunger Coalition follows. It's slightly different because I followed the Hunger Coalition's model, and we don't use the exact wording, but the framework came from FRAC. And they believe there are 4 legs to the food security table: family and economic security, the nutrition programs that are important to support kids and families, accessible and affordable local food systems, and an emergency charitable food system that is strong and has the capacity to handle the number of people coming in that have needs. And as far as the Hunger Coalition, we follow a collective impact model, which means we have 49 different organizations at the table right now that are coming and sharing information. So what I'm sharing with you today, the majority of that has been shared with me by those groups coming to the table. I pulled some statistics, and I didn't put these up on the slides because they're from a group that is slightly controversial. But I wanted to share with you some of what they had in their slides. So when they looked at wages, the average wage increase across the United States from 2009 to 2013 averaged off at about 10%. The cost of basic staples, beef, pork, eggs, the cost has increased 20 to 30%. Another slide that they shared was on rising gas prices. So if you look back at that hourly wage, that average increase, gasoline prices back to 2009 have increased about 40%. 40. The other slide that they shared was on employment. And I think further down, maybe not in these slides, employment, our employment rate, the way they calculate it is it's based on the number of people who have been searching for a job over the last 4 weeks. The people who are engaged in the labor force who have been laid off, or a group that has been paid. Anytime you've received any type of pay, even if it's 15 hours, you are considered part of employment. So when you look at our employment statistics, I urge you to dig deeper into what those statistics mean. Because we talked about underemployment, those people are counted in those employment numbers. So if we look at the percent of people that are unemployed, it doesn't take into consideration the number of people who are underemployed. So I just encourage you when you're looking at statistics to really dig in to understand what those statistics mean. Because we have a lot of people in our community that are employed, the working poor, that are coming to our food pantries because they still can't make ends meet at the end of the month. So a little bit on the Hunger Coalition. So as I said, I'm up here, I'm sharing information, not as an expert on hunger, but as a support staff for the Marathon County Hunger Coalition. And I came into this role, I work for United Way. There's 2 areas that I focus in, and it is income and health. The other area of focus for United Way is education. You can't pull the 3 apart. They are all very intermingled. But being that I am in the education or in the income area, I was asked by the local community many years ago to work with one of our healthcare providers and roll out a survey and find out what was going on in our community on hunger. Because we were hearing from our local food pantries that they didn't have enough food on the shelves to feed people. So we wanted to get an idea of what's going on and what the needs were. So we did this survey, we presented the findings, and many, many years ago, I would say 25 years ago, there was a group that worked on hunger. That group disbanded. And then when we rolled out the results of the survey, they said it's time to pull this back together again. And we asked the group, who would you like to do this? And they asked United Way to step up and to provide staff support for this group. This group, as I said, there are 49 different organizations represented at the table. They guide themselves, they guide their work. I am there to provide information. I'm there to go out into the community, to share what I've learned, to help raise awareness. But they are truly the experts. The people at that table are truly experts. And unfortunately, all 49 couldn't be here with me today, but I know that there are also experts sitting right here in this room that have a lot of information to share with the community. So this is our mission, and I'm not going to read the slides. There's a lot of words on this slide. This is what our mission is. Our goal is to increase food security. Our measurement locally is 211 gathers information on unmet needs from callers. So we want to see a decline by 2025. this should say by 5%, I apologize. But by 2025, we want to see a decline in the number of callers calling us and telling us they don't have enough food. So that is one indicator of success for us. We also want to see the rates of food hardship fall in Marathon County. And the group that does the food hardship survey is Gallup Healthways, and it's a well-being index. We have primary and secondary secondary goals. So this first goal that you saw, this is what our primary goal is here. Our secondary prevention and intervention goals are listed here. So first, what the group wanted to see is they wanted to see us feed more hungry people in need of food assistance. We didn't want to duplicate what was already being done in the community. We have a lot of wonderful food pantries who are doing excellent work. We didn't in any way want to pull food from them and say, give it to the Hunger Coalition instead. That's not what we wanted. Instead, we wanted to expand on the wonderful work that they were already doing. So our focus ended up being nutritious food. One of the very cruel comments that I've heard, and if it was said by one person, I know that some other people were probably thinking it, is I had heard the comment that people going into the food pantries aren't hungry, they're overweight. My thought on that is, number one, I would love to sit for an hour with them and explain the complexities of hunger. But what we were seeing coming into our food pantries, which is why we focused on this, is we are seeing a lot of processed, high sodium food. We don't ever want to turn away donations. We appreciate the donations. But if we want our little ones in our homes to have proper brain development, if we want people to feel good and be healthy long-term, they need the opportunity to have access to the same foods that everybody in this community has. So our focus ended up being on nutritious food. We wanted to increase the awareness of hunger. We wanted to communicate the commitment to healthy food. We wanted to outreach to areas that had fewer food assistance options, meaning the rural area. Our community is a huge community. Marathon County is huge. Colby, Stratford, Edgar, they have some of the similar needs that we do, but fewer resources. And we also wanted to increase volunteer hours that were dedicated to fighting hunger. This is a chart that shows the number of requests for food assistance met by only 8 food pantries in our community. So a little information on this number. These are not unique individuals. People are able to come back multiple times to food pantries. They need to come back multiple times to food pantries. I don't know any one of us that could go into a food pantry and get a bag of groceries and make it last for a month. So they need to visit multiple food pantries, and we encourage them to do it. So there is some duplication in this number, but back to 2008, we started off just over 52,000, and finishing off 2014, we are at 121,000. That's 8 food pantries in our community. There are different types of food pantries. We have what I call the public food pantries, and I provided for you a Give and Get Help guide. This is our Help for Hard Times guide too. It's the red guide. It's this guide right here, yes. It has all of the public food pantries listed. Not all of those food pantries are part of the Hunger Coalition. It doesn't mean they're not doing fabulous work. Some of them just are not at the Hunger Coalition table. The public food pantries are listed here. We also have what some people term underground food pantries. which there are churches that provide food. There are neighborhoods that have different groups that provide food. I've heard that there are possibly close to 40 food assistance programs across Marathon County. This is only 8. As a coalition, we've been up and running for 6 years, and I'm going to go through these fairly quickly. But in those 6 years, this is the number of requests from those 8 pantries. One of our other goals was to raise awareness about root causes. I thank the library for allowing me to be here and give a presentation today. But this lists out what we've done over the last 6 years. Increasing access to nutritious food. We have what's called Share the Harvest, so we have a booth at the Wausau Farmers Market. At the end of the day, if farmers have items that they don't want to take back or they're going to dump, we encourage them to give them to the Hunger Coalition. We will take them back to the food pantries. So that was over 20,000 pounds of food. We have what's called a fruit and vegetable project, where we work with healthcare providers in the community, and they help us purchase direct from some farmers and from grocery stores to be able to provide fresh produce right before distribution day for pantries. We have a fair to pantry project where we have had some people purchase animals at the fair and have it butchered and provided to the coalition to distribute to the pantries. We have cooking on a budget demonstrations. We are working really hard on a grant right now that we hopefully will be able to expand our efforts for providing cooking classes. What we were learning from the pantries was that some people were coming in and they didn't have the skills to be able to cook meals for their family. We are a microwave generation. I use the microwave a lot. Some of those skills that people years ago had for cooking, they've been lost along the way. So we are doing some cooking classes, and a big part of these cooking classes is role modeling healthy eating behaviors, because the research shows us that if parents cook with their kids and sit down and eat with their kids, that role modeling is important for lifelong wellness. We also work very closely with the Rotary Clubs. They've helped us get turkeys at Christmas time and at holiday time. They've also helped us provide over 3,000 dozen eggs to the food pantries. And this year that has expanded, and we will be able to double the amount of eggs we're providing. Communicating commitment to healthy food choices. Once again, our cooking classes, demonstrations. We're doing some we've surveyed the people who've attended. We're seeing great success with the classes and what people are learning. We're also providing some recipes and tips at the farmers market for families that visit us. We look at coordinated food drives. Thank you again to the library for doing a coordinated food drive. That's fantastic. We have an event called United We Can, where can sculptures are built by businesses. We've brought in about 68,000 pounds of food over the years through that event. Coordinated food drives, this is a count over 6 years. Schools have done some wonderful food drives for us and helped us also. Groups like Peyton's Promise are doing an excellent job raising awareness about hunger in our community, especially in the schools, and getting kids engaged, and we need to get the different generations engaged in this to be successful, so thank you for that. Collaborative purchases. We, last year alone, this number needs to be updated. I just looked at last year's numbers. Over 200,000 pounds of food were purchased for the area food pantries as a result of our work. We also do some gleaning projects. If farmers have things that are left in the fields, we don't want them to till it under, give us a call. We'll gather some volunteers, we'll go out and pick. If you like to pick strawberries, if you have a group that likes to go out and pick strawberries, consider picking for yourself and picking some for the food pantry. We have some groups that are doing that now, and it's wonderful for people coming into the pantries to have a choice of fresh strawberries or different items like that. Apples, carrots, potatoes have all been a part of gleaning projects. We've also done some special needs food purchases. We work with the AIDS Resource Center in town, and there are special items that the Resource Center needs for their food pantry. So we also work on providing special items for people that have special health needs. When we started as a group, about 61% of the items that were being donated through the coalition were considered healthier. This last year, when I ran the numbers, we're at 86%. So I was
How do you measure health?
We had someone that was a previous employee at the health department, documented all the foods in color code. So we put everything under a certain color code. It's like red is not healthy, green is good, and yellow is, I'm not remembering exactly what it was, but marginal. So the marginal and good are what's considered in this 86%. And that's not saying we want to limit what's going into the food pantries, never. Everybody has a right to a choice of food. But once again, we didn't want to duplicate what the pantries were already doing, and we wanted to do a better job providing choices. So that's why we went in that direction. Rural outreach, we have a tremendous rural outreach this last year. We connected with 5 rural food pantries. In one day, we went from Colby to Spencer to Marathon to Abbotsford to Hatley. I don't remember all of the different areas, but we traveled all of the outskirts of Marathon County, and we provided food to their pantries. And in total, that distribution was over 20,000 items to those pantries. So we are not the Wausau Hunger Coalition. We are the Marathon County Hunger Coalition, and that includes all those outlying areas. So, what I would like to do, and I don't have the time.
We're getting close, but.
We're getting close? Great. What I would like to do is I would like to have a bit of a community conversation or dialogue on strategies to end hunger in Marathon County. Who we need to focus on, what we need to focus on, and why. I'm going to share a little bit with you about how you can be part of the solution. And then I want to talk a little bit to you about supports available in Marathon County. A big takeaway from this is I want you to know is if people need help, encourage them to go in and get help. We have great supports in our community. We don't have everything that everybody needs, but we've got a lot of great groups out there working on this issue. So encourage people to call 211. I provided all of you with a magnet. Encourage them to look in this guide to see what assistance is available. Encourage them, if they qualify for some of the federal food programs, to get involved. Encourage them, if they have kids, to go, and the Boys and Girls Club is providing meals right now. Encourage them to go. They're free. There are certain schools that are providing free breakfasts right now. Encourage them to go to those. And if you want a schedule or a calendar that has all of those listed, 211 has that, and we'll be able to share it with you. So right now, what I would like you to do is you saw some of the strategies that we were working on, and I can back those up and share those with you. But what are you hearing? What needs to be done? What aren't we doing? Where are the gaps?
2 things. I overheard the conversation when I was looking at books. 2 things. One is we're talking about children not getting, or people not getting adequate or nutritious food. If you've ever been behind somebody, and I'm not saying everybody, but this has been a couple of times, you have people there with their food stamp cards, their food share cards, and their cart is full of chips and soda and things like that. We need to push education